All right, so this is Dr. Leanne Calaba with Lifeline Wellness Center, and I am super excited to go over this presentation with you on vitamin D. So I'm hoping that obviously all of you guys got on the webinar, so you remembered the passcode. That's something new that Zoom is insisting we do, so I tried to make it something really simple and repetitive so that it was easy to log in.
Yes.
I also want everybody to, let's see, hold on one second. There we go. I want everybody to know how to open the chat box. So usually there's a little 3 dots somewhere on your Zoom controls, and underneath there it says chat or chat box. So I want you to know that to open that chat box, and that's where you'll type in any questions that you have. I am going to try and wait till the end to answer all those questions, but I will leave plenty of time to do that. And so it's past 6:30, so we're going to get started. So I want to welcome everybody for attending. Thank you so much. I really appreciate the time, effort, and energy you're putting into your health. So tonight we're going to talk all about vitamin D. So I want you to know what our objectives are. We're going to cover what vitamin D actually is, what does vitamin D do, benefits of vitamin D, health risks associated with vitamin D deficiency. We're going to talk about statistics. We're going to talk about current research, which is really important in today's environment. We're going to hear from the experts. We're going to look at signs of deficiency and those causes. And then, of course, we want to look at solutions, because I want you to know what you can do for yourself. So how much vitamin D do you actually need? And then types of vitamin D supplements and the recommended supplementation. So what is vitamin D? Vitamin D is actually a fat-soluble vitamin that's present only in small amounts in certain foods, and it's actually made mostly inside our bodies when we're exposed to sunlight. It's stored in the liver and fatty tissues, and it's also known as 25-hydroxyvitamin D. So like I said, the body makes most of it on its own with the help of sunlight. So many people assume that the best way to maintain a normal vitamin D level is by drinking milk or eating fish. Now, these are some foods that serve as sources of vitamin D, but direct exposure to the sun is actually the best way to absorb this vitamin. So it's believed that up to 90 to 95% of most people's vitamin D actually comes from casual sunlight exposure. So the body actually converts the sunlight into chemicals that are then used in the body. And specifically, when UVB rays land on the skin, a substance in the skin called 7-dehydrocholesterol is converted into vitamin D3. Now, vitamin D3 is the more active form of the vitamin. It's also called cholecalciferol. So this cholesterol in our skin, which is very similar to a regular cholesterol, actually converts what the sunlight provides into the body, which is called pre-vitamin D, into the usable vitamin D3. So vitamin D actually is a hormone within the body, and when it's in its hormone form, it's called calcitriol. And in the absence of adequate sunlight, supplementation is extremely beneficial and actually essential. So research indicates, so we're talking now about what does vitamin D do? Research indicates that vitamin D impacts your bones and skeletal structure, your immune function, blood pressure, mood, your brain function, and your overall ability to protect against a range of illnesses. Now, specifically, a 2019 review included benefits of vitamin D to include bone health and immunity, resistance against chronic conditions, which includes heart disease, cancer, diabetes, and depression, along with helping fight infections and viruses. So how does vitamin D actually do that last piece? Well, first of all, vitamin D binds to certain cells that are in your body, and they're part of your innate immune system, and it helps those cells kill viruses. So this is going to be really important in what we talk about later. Vitamin D is actually necessary to help your immune system attack and kill a virus. How else does vitamin D help your immune system? Well, the second part of your immune system is called your adaptive immune system. So vitamin D in the adaptive immune system reduces inflammation, and it reduces the possibility of a cytokine storm. And again, I don't want you to memorize this right this second, but this will help you understand what's happening later when we talk about the current statistics and the current research. So the piece I want you to take away is that vitamin D helps two parts of your immune system. It helps your innate immune system, which really just attacks viruses generically. And then it helps your adaptive immune system, which is really specific and targeted at specific viruses. And it helps in the inflammatory process as well as the cytokine storm. So even more benefits of vitamin D. It contributes to bone health. It supports the immune system, and it helps prevent prolonged or excessive inflammatory processes. Now, specifically talking about bone health, what vitamin D does is it aids in calcium absorption into the bones, as well as other vitamins and minerals that contribute to bone health, including magnesium, vitamin K, and phosphorus. Adequate levels of vitamin D also help protect against infections and viruses by regulating the role of white blood cells, which is what I just talked about. It actually decreases the virus's ability to reproduce, and it activates enzymes that prevent tissue damage. Now, research also shows that vitamin D helps with healthy cell replication, and it may play a role in protecting against the development of autoimmune conditions, infections, and viruses again, in less serious illnesses, even like the common colds and the flu. There's evidence that humans need enough vitamin D in order for those immune cells, specifically macrophages, which are a type of white blood cell that attack pathogens, to do their job properly. Vitamin D can help support healthy cell replication and helps control inflammation. So it may also benefit those with chronic diseases and autoimmune disorders that have that inflammatory process underlining them. And that includes things like MS, rheumatoid arthritis, irritable bowel syndrome, and other digestive disorders, and high blood pressure. So this is just a few of the things that vitamin D does. It also helps support your cardiovascular system. It helps regulate blood pressure, cholesterol levels. It helps manage blood sugar levels, and it works with calcium to regulate insulin secretion. Diabetes symptoms result from a lack of insulin or inadequate insulin secretion, which then leads to insulin resistance. So according to research conducted at the London School of Medicine and Dentistry, calcium is necessary for insulin secretion, and vitamin D benefits and promotes calcium absorption and utilization. Therefore, it contributes to the regulation of insulin secretion. Another study that was published in Current Diabetes Reviews showed that vitamin D replacement has beneficial effects on all aspects of type 2 diabetes. So I'm sure a lot of people probably didn't know this, that one of the big benefits of vitamin C is that whole blood sugar control. There is even mounting evidence that low levels of vitamin D contribute to type 2 diabetes. And the last couple here is that vitamin D helps prevent depression and mood disorders. It helps keep your mood positive. It helps keep your energy levels up, and it helps treat seasonal affective disorder. So, and lastly, vitamin D plays a role in the factors that influence the growth of tumors, cell differentiation, and apoptosis. And so this all is supportive in the fight against cancer. So apoptosis is the process when a cell reaches the end of its useful life, that it actually dies and is cleared out of the body. In cancer, cells don't die the way they're supposed to. So vitamin D helps those cells die like they actually should. And so vitamin D deficiency symptoms have been correlated with increased risks of cancer development because those cells aren't dying off the way they're supposed to, and especially breast cancer, colon cancer, and prostate cancer. So we just covered a lot of benefits of vitamin D. It actually plays a role in many healthy processes in your body. So as a whole, then, what are the potential health risks associated with a vitamin D deficiency? So first of all, we have weakened bones. A deficiency in vitamin D can soften your bones, which is called osteomalacia. Additionally, a deficiency increases your risk of developing osteopenia and osteoporosis and experiencing fractures. Susceptibility to infections and viruses have been linked to low levels of vitamin D, and even some really serious infections, including those that affect the lungs and respiratory system. So this is why vitamin D has been found to be so helpful in our current virus situation. Mood disorders are also a health risk. Because vitamin D acts like a hormone within our bodies and affects the brain, vitamin D deficiency has been linked to an increased risk for mood disorders like depression, seasonal affective disorder, and severe mood swings, insomnia, anxiety. Vitamin D deficiency is also linked to hormone imbalances. So low levels of vitamin D can interfere with proper testosterone and estrogen production. That leads to imbalances that can result in many unwanted symptoms. Can it cause weight gain? And that's certainly a possibility as well. Some studies show that lower levels of vitamin D result in more weight gain in older adults. And so that's definitely a possibility as well. And then cognitive and mental issues are also risk associated with vitamin D. So research has indicated that people with lower levels of vitamin D actually perform lower on standardized exams. They may have poor decision-making skills. They have difficulty with tasks that require focus and attention. Some research has even demonstrated a correlation between low levels of vitamin D and an increased risk for schizophrenia and multiple sclerosis, like I mentioned earlier. And lastly, we talked about cancer already. So potential risk associated with low levels of vitamin D. So vitamin D deficiency has been correlated with increased cancer development, and especially breast, colon, and prostate cancers. So the Frontiers in Endocrinology is a research a magazine that talks about how vitamin D plays a role in influencing tumor growth, like I mentioned earlier, and that it absolutely can play a role in these cancers because of its ability to block excess estrogen. So there are a ton of health benefits and risks associated with vitamin D. So let's talk about statistics. If vitamin D is this important, it's really great. It would be really great if everybody had adequate levels of vitamin D in our bodies. Unfortunately, 40 to 80% of adults in the US are believed to have a vitamin D deficiency. And I repeated in here that 95% of our vitamin D comes from casual sunlight exposure. And the reason I wanted to make this point again is that even though we live in sunny Tucson, Arizona, most of us are still deficient in vitamin D. So it's really important to understand that. So there's already evidence that suggests getting enough vitamin D regulates the immune system for optimum health. And now we're jumping into the current research. Vitamin D also enhances innate immunity, just like I explained before, while reducing the severity of inflammatory responses and supporting antioxidant activity. Well, what else does vitamin D have to do in the current research? Vitamin D deficiency correlates with risk of acute respiratory distress syndrome, sepsis, and death from these issues. So again, we're going to talk about this in a little more detail here in a second. But one of the problems with the coronavirus is people dying from the acute respiratory distress syndrome. So if vitamin D deficiency increases the risk of this ARDS, then having sufficient vitamin D should also help people deal with the coronavirus. I think it's really interesting to note that the biggest study so far to come out from Europe says that the probability of developing coronavirus and dying from it is negatively correlated with vitamin D status. And the probabilities are actually 0 if you have 75 nanomoles per liter of vitamin D in your blood. So basically what this is saying is that if you have adequate vitamin D levels, you are less likely to get the coronavirus, you are less likely to have severe symptoms, and if you reach a certain level, you actually have a 0% probability of dying from the coronavirus. Now, this isn't me saying this. This is coming out of the research. These are facts that cannot be disputed. Additional research reveals that vitamin D deficiency is one of the primary risk factors for severe COVID infections, hospitalizations, complications, and death. Researchers have demonstrated that vitamin D can reduce damage to the capillaries that connect to pieces in the lung called the alveoli to larger blood vessels and help prevent that acute respiratory distress syndrome. Another study revealed that vitamin D was shown to have a protective effect on the lungs. Again, all of these things are part of what people are experiencing with coronavirus. And so if you have adequate vitamin D levels, what research is showing is that vitamin D has a protective effect. The newest study that I found looked at 216 people who had COVID-19 and found that 80% of those people did not have adequate levels of vitamin D. So people who had COVID-19 and lower vitamin D levels also had a higher number of inflammatory markers, which is linked to poor COVID-19 outcomes. Again, we have more current research. A different study found that COVID-19 patients who had adequate vitamin D levels had a 51.5% lower risk of dying from the illness and a significantly reduced risk for complications. People with a vitamin D deficiency have a higher prevalence of hypertension and cardiovascular disease. They also had longer hospital stays for COVID-19. Now, the reason is because these are the common comorbidities. So people with hypertension and diabetes and obesity have a harder time with COVID-19. They also have low vitamin D levels. This is all what the current research is telling us. So again, we go back to vitamin D can strengthen your immune system. It can do so in a matter of a few weeks. As a result of this, researchers are saying that correcting vitamin D deficiency and having adequate levels of vitamin D can literally save thousands of lives. Hospitalized COVID-19 patients that were given supplemental D3, in addition to the standard of care in the ICU, their admissions were dropped from 50%, in the ICU to 2%. And they completely eliminated the deaths. So this was actually a randomized clinical controlled trial that resulted in this information. So if they had adequate vitamin D levels and standard of care, zero of them died. So this is really important. There are things we can do for the coronavirus in the face of everything that we're being taught to fear. Now, it's not a silver bullet, it's not a cure-all, it's not an instant fix, but it can absolutely support your body and your immune system. So another study found that Corona-19 patients with a vitamin D level of at least 30 nanograms had a significantly lower risk of adverse clinical outcomes. There was data analyzed from almost 200,000 American patients, and if they had a vitamin D level of at least 55 nanograms, they had a 47% lower positivity rate than those who had vitamin D levels under 20. So again, that's showing you that vitamin D can have a protective effect even from contracting the coronavirus. So I just covered a lot of statistics. I hope I didn't go through that too fast. I'm going to make this recording available to everybody so that you can watch this again. So the bottom line from the experts is, how can we fix this pandemic in a month? This literally is the title from the research that was published. And what I've highlighted there is in yellow. Having a good vitamin D status would greatly reduce the risk of contracting the infection, of the disease becoming severe, and of dying. So that's what we take from all of that research that I just went over. And again, this is coming from the research, it's coming from the experts. It's not just something that I'm saying. So let's look at some signs of vitamin D deficiency. We have fatigue, osteoporosis or bone fractures, susceptibility to infections, a higher risk for cardiovascular disease and high blood pressure, higher risk for certain types of cancer, autoimmune diseases, depression, insomnia, arthritis, asthma, chronic pain, skin issues such as psoriasis, and even developmental problems in babies and children are signs of vitamin D deficiency. So let's look at the causes. So as I talked about before, because so much of our vitamin D comes from sunlight, one of the main causes is a lack of sunlight exposure. Also, our frequent use of sunscreen. You know, being out in the sun but putting on sunscreen prevents us from absorbing those UVB rays. Underlying health conditions such as obesity or type 2 diabetes, insulin resistance, and hypertension all can lead to vitamin D deficiency. Obviously, having darker skin can also create that vitamin D deficiency. Age, it's actually an age-related issue. Being over the age of 70 is a higher risk factor for deficiency. Certain occupations that limit outdoor time, including being a shift worker, a healthcare worker, or anybody who works indoors because of the lack of sunlight exposure. Being in a nursing home resident or a hospitalized patient, obviously for the same reason, because you don't get out as much in the sunlight. And then having celiac disease or other digestive issues like Crohn's, in cystic fibrosis with the lungs actually interferes with the absorption and processing of vitamin D, whether that's in the intestines, kidneys, or liver, are also causes of vitamin D deficiency. All right, so who's ready for some solutions? It's really important to me that every time I do a webinar, I actually give you guys some information that you can take action on, that you can implement, and that you can do for yourself. So certain foods, such as fish, eggs, and dairy, provide some vitamin D. but there's not large amounts of vitamin D in those foods. And so the best solution is actually exposure to sunlight. The problem is, like I said, is that most of us don't get sufficient sunlight. I do want to go over some additional foods in case anybody's interested that contain higher levels of vitamin D. So we have all kinds of the oily fish. So we talk about cod liver oil, halibut, carp, mackerel, eel, wild-caught salmon, whitefish, swordfish, trout, sardines, tuna. And then we have eggs are a good source of vitamin D, beef liver, raw milk, caviar, which I know we all have sitting in our cabinets at home, right? And then fortified milk alternatives such as nut-based milks also have small amounts of vitamin D in them. So anybody who is looking to supplement their vitamin D through food, this is a great list of items to put on your next shopping trip. But like I said, while sunlight is actually the best source, up to 95% of most people's vitamin D comes from casual sunlight exposure. The problem is that many people don't spend enough time in the sun each day, or they don't regularly consume the foods that we talked about. And so supplements are actually necessary, or at least encouraged, and even in some cases necessary. So if you were to spend enough time in the sun, you actually need 20 minutes of full body exposure. So what that means is 20 minutes without any clothes on. So I don't know how many of you guys have a backyard that would allow you to lay out in the sun naked for 20 minutes. That's what you would need to do every day to get adequate exposure to the sun to produce the vitamin D that your body needs. So in lieu of that, what we can do is focus on some supplements. So the Endocrine Society recommends that infants should get anywhere from 400 to 1,000 international units daily, children to get 600 to 1,000, and adults 600 to 2,000. Now I'm going to give you a slightly different number here in a second. This would really be, these numbers right here are really based on the idea that your vitamin D levels are already adequate and all you're doing is trying to maintain them, okay? So in the end, these levels actually are not enough if you're already vitamin D deficient, and most of us are. So I'm going to go back to that article, How Can We Fix This Pandemic in a Month? This article is actually written by a gentleman who has been studying and publishing on vitamin D for over 30 years. And what he says is that an adult will need to take 4,000 international units a day of vitamin D3 for 3 months to reliably raise your vitamin D levels enough to give you that protective effect against the virus that we're all facing right now. So that's 4,000 IUs a day of vitamin D3. Okay, so I want to make sure everybody gets that number down. And so that's going to play into my recommendation coming here in a second. There really is no downside to increasing your vitamin D intake unless you actually have some disorder or disease that vitamin D is detrimental to, such as sarcoidosis or other granulomatomas, excuse me for not pronouncing that appropriately, disorders. And I'm going to go over some of those issues here in a second as well. So what should you know about vitamin D supplementation? So first of all, there are actually 2 forms of vitamin D supplements. You can get vitamin D2 or D3. Now D3 is actually the more active form. It comes from animal products, and specifically the cholesterol that's within those animals. It's closest to what sunlight naturally produces in humans when the skin works to convert that UV light. D3, like I said, is the more active form, and it's believed to be 500 times more usable than vitamin D2. So if you have the option of vitamin D3 over vitamin D2, absolutely pick the D3. Now, unfortunately, for most of the foods that are vitamin D fortified, like dairy products, they're actually using vitamin D2 instead of vitamin D3. So again, it's not necessarily a great choice to rely on those foods to get the levels that you actually need. It's really better to supplement. And this is why we're doing our supplement special in the office. We actually have a really great supplement that's called Biodemulsion Forte. Each drop provides 2,000 international units of vitamin D3 of the kind that we want, and it's highly absorbable. It is emulsified already. It's basically in a form that your body can absorb and assimilate extremely easily. So this little bottle, to get your 4,000 drops, you would only have to do 2 drops a day. There are, I believe, 750 drops in this bottle. So this bottle basically should last you 6 months to a year. And it's actually my absolute favorite vitamin D supplement. I take it every day. I even take a little bit more than those 4,000 units. I actually take closer to 10,000 units 3 to 5 days a week. So that's the supplement that we're actually recommending. Now, it is important to be aware that you can have a vitamin D toxicity. If you take more than 300,000 international units in a 24-hour period, so that's a whole lot of vitamin D, or more than 10,000 IUs of vitamin D for months at a time, you could potentially cause a vitamin D toxicity. So I just want everybody to be aware of that and make sure that you're not taking too much. There are also some issues related to vitamin D and regarding medications. So I just want to list these here quickly and let you guys look through them. Really what you need to do if you're on these types of medications, my recommendation is just to talk to your primary care physician before you start eating large amounts of vitamin D. And the reason why it's a problem is that vitamin D actually improves how your body functions. And so, for example, I'm going to take the diabetes medication. If you're on a certain amount of diabetes medication and you start taking vitamin D, and all of a sudden your body starts working better and you don't need that much diabetes medication anymore, then that's a problem. Then you're actually taking too much of the diabetes medication because now your body's doing what it's supposed to do. So it's always good to run this by your primary care physician so they know what's happening and that they can adjust your medication levels as necessary for some of these that are listed here. So I hope that makes sense to everybody. Now, of course, the last question is always that I always get asked is, well, how can I get my vitamin D tested? Okay, so first of all, like I mentioned, there's no downside to improving your vitamin D levels. So really, you don't have to be tested. You can just start increasing your vitamin D. But if you really wanted to, if you're a nerd like I am and you want to know what these numbers are, you can actually order your own test through a business called Any Lab Test Now. No prescription is needed for that vitamin D test. They charge $125. You can also order your own at-home finger prick test kit to test your own vitamin D directly through a lab. And I've included a link here for that. And that test is actually significantly less. It's only $65. And in either of these cases, if you guys wanted to get this testing done and bring your results in here and then let us help you figure out how much vitamin D you need, we'd be happy to do that. So we've got any lab test now, which is local. It's actually at Sabino Canyon and Tanque Verde Road. We have this online test kit. And then obviously you can always go through your primary care physician and try and get your insurance to pay for it. So that's an option as well. So I have in the past had my vitamin D tested through both Sonora Quest and LabCorp. So I know they both do it. You really shouldn't have an issue if you just ask your primary care physician to order that test and get it covered by your insurance. So the last thing I want to wrap up with is just because of in the face of all the scrutiny that's happening right now with all the information out there, I wanted to provide you with the resources that have all of these research articles linked in them that I used tonight. Because there really are steps that you can take for yourself regarding your immune system in general, regarding your bone health, regarding preventing chronic disease and illness, and even steps to help protect you against the virus that we're facing right now. And there's a lot of fear around. Again, like I said, it's not a silver bullet, it's not a protect-all, but it definitely can boost your immune system and give you some added benefit in the face of the CV-19. And so I just want to recap. What I would recommend everybody doing is taking 4,000 IUs of that vitamin D every day to help boost your immune system and your immunity against viruses and pathogens. So with that, my goal today was to give you as much useful information as possible in about 40 to 45 minutes. So I think I've done that. I want to open it up, the chat up to any questions that you guys might have. Also want to let you know that that vitamin D is 20% off in the office right now, and it will be for the rest of the month. So you can come in and get that special. And get started on increasing your vitamin D really easily and pretty quickly. So does anybody have any questions? I'm actually going to type a little message in the chat box. Maybe that will make it pop up for you if you weren't able to open it.